Class, our topic for today is about the circulatory system. I know this topic is very familiar with you because you already passed your anatomy and physiology. Okay? So, what is the function of the circulatory system? Okay? The function is to transport oxygenated blood, or also known as oxygen-rich blood, okay, or carbon dioxide depleted blood. Okay, so iisa yun class ha. Pag binanggit kong oxygenated blood, it is same with carbon dioxide depleted blood, okay, and oxygen-rich blood. Iisa yun, okay? So the circulatory system transport oxygenated blood or oxygen-rich blood from the heart and lungs and all throughout the body via our arteries. Okay? Whereas the oxygen-depleted blood or the carbon dioxide-rich blood is returned to its origin via the veins. Okay? So class, keep in mind that the arteries, okay, inside the arteries, oxygenated blood flows. Okay? Whereas in the veins, carbon dioxide rich blood flows. Okay? Arteries, oxygenated blood. Okay? Veins naman, carbon dioxide rich blood. Okay? So, another function of the circulatory system is to help in the coagulation process, regulates the body's temperature, and assist in the fighting of diseases, no? Specifically, mga infection. The main components of our circulatory system is number one, we have the cardiovascular system, and number two, we have the lymphatic system. Let us first discuss the cardiovascular system. Okay, so let's start with the layer structures of the heart. Okay, so when we say heart, it is a hollow organ. Take note, a muscular organ. Ay kaya nga nagpo-pump siya ng blood, nagko-contract siya. Okay? Kasi nga, it is made up of muscles, specifically cardiac muscles. In our heart, we have four chambers. We have the left atrium, right atrium, left ventricles, and right ventricles. Okay? Our heart is surrounded by pericardium. So when we say pericardium, it is a thin fluid-filled sac. Okay? So itong pericardium, it is filled with pericardial fluid. Okay? So the heart is about the same size of a man's clenched fist. Okay? So ganun daw class, no? Kung gano'n daw kalaki yung kamao mo, okay? Clenched fist, yung kamao, ganun daw kalaki yung heart mo. Okay? So the heart weighs less than 1 pound or 250 to 350 grams. Okay? Now let's proceed to the layers of the heart. Okay? So later on, meron tayong picture class, no? So, ito class, kung mapapansin nyo, ito yung ating pericardial sac. Si pericardial sac, meron niyang laman na pericardial fluid. Okay? So, yan yung outer covering ng ating heart. Okay, pericardial sac. So in the layers of the heart, okay, we have the epicardium. Okay, so epicardium is a thin, watery membrane in the outer layer of the heart. Okay, it covers the heart and it is attached to the pericardium. Okay, so class, ito yung pericardium natin. Si pericardium, ang nakadikit sa kanyang layer ng heart ay si epicardium. So class, para hindi kayo malito, pag sinabing epi, okay, it means outer. Epi means outer. Okay, so that's why siya yung outermost covering of the heart. Okay, so again, di ba meron tayong pericardial sac. So si pericardial sac, meron tayong tinatawag na parietal pericardium, yun yung outer portion ng pericardial sac. At meron tayong inner portion ng ating pericardial sac, ang tawag doon is visceral pericardium. Ngayon, si visceral pericardium, okay, naka-attach siya kay epicardium. Okay, I hope that's clear, class, ha? Okay, epicardium, visceral pericardium, and parietal pericardium. Si myocardium, siya yung middle layer of the heart. Okay, it is made up of muscles, specifically cardiac muscle. Okay, so the function is pump blood to the arteries by contracting. Okay, nagko-contract siya kasi nga madami siyang muscle. Okay, next layer is the innermost layer or also known as the endocardium. As the name implies, endo means inner. Okay, so endocardium is a thin layer of epithelial cells in the inner layer of the heart, and its function is to line the valves and the interior chambers of the heart. Okay, so tandaan niyo yan, class. We have 3 layers of the heart: outermost layer, epicardium; middle layer, which is made up of cardiac muscles, myocardium; and the innermost layer, which lines the valve and the other chambers. Okay, it is called endocardium. Okay? Okay. So, ayan siya, class. Epicardium, myocardium, and endocardium. Okay? Epicardium, siya yung naka-attach kay visceral pericardium. Okay? Baka kasi pag nagtanong ako sa quiz, what type of pericardium is attached to your epicardium? Okay? So, pag ang sinagot nyo is pericardium lang, wrong. It should be specific. No? So, the answer is visceral pericardium. Okay? Okay. Next class, let's proceed to the chambers of the heart. Okay? Sabi ko kanina, meron tayong 4 chambers of the heart. Okay? Let's start with your atrium. Okay? Let's start with your right side of the heart. Okay? Right atrium is the upper right chamber, or it is located on the upper right chamber, and its function is to receive the oxygenated blood. So, pag sinabing the oxygenated blood, it is same as carbon dioxide rich blood or oxygen depleted blood. Okay? Baka kasi malito, class. Pwede kong pagpalit-palitin yung mga terms. When we say deoxygenated blood, as the name implies, de means remove. Okay? So it means walang oxygen yung blood na yon. Since wala siyang oxygen, anong laman niya? E di carbon dioxide. Okay? So oxygen depleted blood, carbon dioxide rich blood, deoxygenated blood, they are all the same. Okay? So the right atrium receives the deoxygenated blood that was already used by the body. Okay? Okay. Next chamber is the right ventricle. So this is the lower right chamber. So yung upper right chamber mo, okay? Upper right chamber, this is the right atrium. Okay? Sa baba, meron kang ventricle. Okay? So ano kayang function ni right ventricle? It receives the blood from the right atrium and pumps into the pulmonary artery. So class, take note, it receives blood from the right atrium. So ano kayang uri ng blood ang kinikerry ng ating right ventricle? Of course, same with your right atrium, deoxygenated blood then. Okay? Again, what type of blood does the right ventricle carries? The answer is deoxygenated blood. Bakit naging deoxygenated blood? Because it says here that its function is to receive blood from the right atrium. Eh ano ba yung laman na blood ni right atrium? Diba deoxygenated blood din? Okay? So same lang sila with your right ventricle. Okay? Next class, we have the left atrium. The left atrium, it is located on the upper portion left chamber. Okay? Its function is to receive oxygenated blood from the lungs and pumps it into the left ventricle. Okay? So, si oxygenated blood, same lang siya with your carbon dioxide depleted blood and oxygen-rich blood. Okay? So carbon dioxide depleted blood, oxygen-rich blood, oxygenated blood, they are all the same. Okay? Left ventricle is located at the lower left chamber and it receives blood from the left atrium, meaning that the kind of blood that the left ventricle carries is also oxygenated blood. Okay? And it pumps into the aorta. Whereas the right ventricle, yung na-receive yung blood from the right atrium, pinapump niya papuntang pulmonary artery, papunta sa lungs. Whereas, ito namang si left ventricle, yung na-receive niyang blood from the left atrium, napupunta kay aorta, then si aorta, okay, madami na yung branches, okay, to deliver it to the body, all throughout the body. Okay, so yan yung 4 chambers of our heart. So we have here the right atrium. We have here the right atrium, we have the right ventricle, we have the left atrium, and we have the left ventricle. Okay, so yan yung diniscuss nating 4 chambers of the heart. Okay? So, si right side ng heart, it receives the carbon dioxide rich blood or the deoxygenated blood. Okay? So, yung blood na kinikerry ng right side ng heart, pinupunta niya sa pulmonary artery para kumuha ng oxygen. Okay? Then, si left atrium naman, it receives oxygenated blood. Ibig sabihin, may oxygen na yung blood. Then, bababa yung blood papunta sa left ventricle. Okay? Then, papunta sa aorta. Then, si aorta, siya na yung magpapamigay. May branches na yan. May different kind of branches na yan para mag-deliver ng oxygenated blood all throughout the body. Okay? So, ganun yung function ng 4 chambers ng heart natin. Okay? So, class, we have 2 types of septa. Okay, we have interatrial septum and the second one is the interventricular septum. So class, as the name implies, inter, okay, it means it divides. Okay, so interatrial septum partitions or separates the right atria from left atria, whereas interventricular septum separates the right and the left ventricles. Okay, so ganito siya class. Interatrial septum, and we have the interventricular septum. So now class, let's talk about the valves of the heart. We have 4 types, okay? So the first one is called the right atrioventricular valve or right AV valve, or also known as your tricuspid valve. It is called tricuspid valve for the reason that it has 3 cusps. Okay, so ito. 1, 2, 3. Tricuspid valve. Okay. So the function of the tricuspid valve is to prevent the backflow of the blood to your right atrium. So yung deoxygenated blood, once it flow through your right ventricle, this tricuspid valve will close. So it will not allow, okay, the backflow of blood papunta again doon sa right atrium. Okay. Okay, next one is the left atrioventricular valve, or also known as your bicuspid or mitral valve. So it is called bicuspid valve for the reason na meron daw siyang dalawang cusps. Okay, so ito yung cusp niya. Okay, so this is your bicuspid valve, also known as your mitral valve. Okay, so meron daw siyang 1, 2. Okay, so meron kang 2 cusps, kaya bicuspid valve. Okay, so the function is same with your tricuspid valve. So to prevent the backflow of the blood to your left atrium. So pag sa left atrium, yung blood na galing kay left atrium, it flows to your left ventricle. So to prevent the backflow of the blood from the left ventricle to your left atrium, this bicuspid valve will close or will shut. Okay? Okay. So now class, let's proceed to the right semilunar valve, or also known as your pulmonary or pulmonic valve. Okay? So in here, this is your pulmonary valve. Okay, so once the blood is inside your right ventricle and it passes through your pulmonary trunk, this valve will close. Okay, so to prevent the backflow of the blood from your pulmonary trunk to your right ventricle. Okay? So class, no, napaka-important ng mga valves. Kasi imagine, if yung mga valves na yan is not working properly, okay, what will happen? If there is a blood here, okay, merong natirang blood, and if there is a backflow of blood that is happening inside your heart, the tendency is that the blood that is left in the previous ventricle or to the previous chambers can form a clot. Okay, then that clot can travel in different veins, in different arteries. Okay, so it may become a cause of stroke or obstruction to the blood flow of the heart. Okay, so that's why it is very important that these valves should work properly. Okay, so to prevent the backflow of the blood, because the blood that is left to the previous chamber can become a clot, and that clot may travel into several or different arteries or veins and may cause an obstruction of the blood flow and may cause stroke eventually or heart attack. Okay? So next class is your left semilunar valve. So the left semilunar valve is also known as your aortic valve. So this is your aortic valve. Okay, aortic. So to prevent the backflow of the blood to your left ventricle. Okay? So yung blood na nag-pass through the left ventricle papunta doon sa ating aorta, okay? So to prevent the backflow para hindi bumalik, this valve should shut. Okay? Should be closed. Okay? So yun class yung mga function ng valves natin, no? They prevent the backflow of the blood. So now class, let's proceed to these terminologies that is related to our heart. Okay, so let's discuss them one by one. Okay, so the first term that we're going to define is the cardiac cycle. So when we say cardiac cycle, it is the systole and diastole that lasts for 0.8 seconds. So ito class, ito yung nangyayari pag nagko-contract and nagre-relax yung ating cardiac muscles. Okay? So yung isang cycle ng pagdaan ng oxygenated blood and deoxygenated blood all throughout our heart is called the cardiac cycle, and it only lasts for 0.8 seconds. Okay? Next is the electrical conduction system. So itong sa electrical conduction system is the one that sends electric impulses all throughout the myocardium. Okay? So ito class, it is initiated by our pacemaker, the sinoatrial node. Okay? Or the sinoatrial node. So ito class yung nagseset ng pag-contract ng muscles ng heart. Okay? So kaya nga class yung ibang patient natin, pag sira yung kanilang pacemaker, kung mapapansin nyo, yung heart nila, pag nagpa-pump, randomly, yung mga chambers kung saan walang nagko-control kung sino muna yung magko-contract. Okay? Kasi may rhythm yan class, di ba? Okay? Depende yan sa daan ng blood flow sa heart. So yung nagbibigay ng electrical impulse para sa cardiac muscles nating mag-contract on time is called the sinoatrial or the sinoatrial node, or also known as the heart's pacemaker. Okay, so yun class. Next class is the ECG or the electrocardiogram. So, ito yung ginagawang isang test, okay, to diagnose an abnormality to the heart. Okay, so ECG provides a graphical representation of the cardiac cycle's activity. Okay, next class is the origin of the heart. So, yung origin ng heart sounds, meron kang maririnig dyan na lub and dup. Okay? So, yung unang sound na lup, okay, ibig sabihin nun, it is the sound as the ventricles contract or the atrioventricular valves close. Okay? So, class, di ba? Pag naririnig natin yung heart natin, okay, parang dug 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 dug. Okay, so the more appropriate sound, okay, is lub dup, lub dup, lub dup. Okay, so yung sound niya, yung first sound niya na lub, okay, so yun palang naririnig natin na yon is the ventricles contraction or the atrioventricular valves closed. Okay, yung pag-close niya. Whereas yung second sound na dup, okay, is heard when the semilunar valves close or the ventricles relax. Okay, so yun class, yun pala yung naririnig natin pag pinapakinggan natin yung heartbeat or yung heart sound, no? Lub-dup, first sound, ventricles contraction, dup, second sound, it is when the ventricles relax. Okay? Next class is the heart rate and the cardiac output. So the average heart rate is 72 beats per minute or BPM. Okay, yung average. Okay? And the cardiac output refers to the volume of blood that is pumped per minute. So ito class, meron tayong computation dito. Okay, may computation tayo kung para masabi natin na tama yung cardiac output ng isang pasyente. Okay? This is the pulse. So when we say pulse, it is a rhythmic throbbing resulting from the alternating expansion and contraction of the artery. Okay? So yung pulso natin, pag pinapakinggan natin yung pulso natin or binibilang natin yung pulse rate, okay? Ang nandun pala sa pulse natin ay yung arteries. Okay? Di ba class, meron tayong iba't ibang location na kung saan pwede nating maramdaman or ma-feel yung pulse rate ng isang pasyente. Okay? So, yung nakikita pala natin doon or yung pinapakinggan natin doon, okay, is yung pag-contract ng artery. Okay? And lastly, we have the blood pressure. So, it is the force which was exerted by the blood on the walls of the vessel. Okay? Which is measured by a sphygmomanometer. Okay? Sphygmomanometer. Ito yung sinasabi nating pang-BP. Okay? Sphygmomanometer ang tawag doon. Okay? The blood pressure has a difference between the systolic, okay, and diastolic pressures. Pag sinabi natin systolic, it is the contraction, okay, of the blood vessel, whereas the diastolic is the relaxation of the blood vessel, specifically the arteries. Okay? So class, no, kung may face-to-face classes tayo, ang activity natin para sa circulatory system is magba-blood pressure tayo. Okay? Kukuhanan natin yung blood pressure ni classmate. Tuturuan ko kayo kung paano mag-blood pressure. Okay? Okay. So now class, let's proceed to the disorders, okay, of the circulatory system. Okay? So we have here the angina pectoris. Okay? It is also known as chest pain. Okay? Pag sinabing nag-chest pain ako, yung pasyente, tapos inuubo-ubo, hindi makahinga, more likely, baka aatakihin yan sa puso. Okay? So, kaya ER agad ang pasok ng ganong pasyente. So, angina pectoris, chest pain resulting from the reduced blood flow to the heart. Okay? Next, we have here the aortic stenosis. So, pag sinabi natin aortic stenosis, you can hear a murmur sound. Okay? So, hindi yun normal class, ha? Okay? So, dapat ang mahiririnig mo lang kasing sound sa heart is lub-dup, lub-dup. Okay? Pag may other sounds dyan, like the murmur sounds, Okay? Ibig sabihin, the aortic leaflets, okay, failed to fully open during the systole. Okay? So, yun yung aortic stenosis. May murmur sound. Okay? Next is the bacterial endocarditis. So, pag sinabing itis, may inflammation na nangyayari. Okay? So, it is an infection that happens when a bacteria enters and resides in the heart lining or the blood vessels. Class, take note, natandaan niyo ba yung layers of the heart? Di ba meron tayo dong endocardium? So, pag ang bacteria nag-reside doon sa lining ng heart, specifically sa endocardium, okay, nagkakaroon siya ng endocarditis. Okay, namamaga yung lining ng heart due to bacteria that is present and residing on the patient's heart. Okay, next we have here the congestive heart failure, or sinushortcut siya as CHF. Okay, so congestive heart failure results to the general feeling or weakness due to the insufficient blood being pumped by the heart. Okay. Next is the myocardial infarction, known as the heart attack, due to the decrease or full stoppage of blood flow to the heart. Okay, so that damages the heart muscle. So class, no, bakit tayo nagkakaroon ng full stoppage or obstruction? Minsan, merong atherosclerosis si patient. May bumarang cholesterol. Okay? May build up ng plaque doon sa lining ng kanyang blood vessel. Okay? Pwede siyang magka-heart attack. Okay? So, yun yung myocardial infarction. Okay? Next class is pericarditis. So, may itis na naman tayo. Ibig sabihin, may inflammation. So, pericarditis is an inflammation of the pericardial sac that may be due to a viral infection. Okay? So, ayan class. Pericarditis, ang namamaga naman dito is pericardial sac. Okay? Ito class, other test naman, okay, to diagnose the diseases of the heart. Okay? So, we have here the ABG, okay, arterial blood gases. So, itong si arterial blood gas, kinukuha po siya via yung tinatawag nating arterial puncture. Okay? So, yun class. Yun yung sinasabi ko sa inyo na hindi medtech ang gumagawa. Okay? Sino ang gumagawa nun? Respiratory therapist or doctors. Okay? So, pag sinabing arterial blood gases, titignan natin kung enough ba yung oxygen, carbon dioxide na dumadaloy sa blood ng pasyente. Okay? Next is the AST and the SGOT. Okay, so itong mga type ng enzyme na ito, class take note ha, pag nag-e-end sa ACE, ganyan, ASE, ASE, more likely mga enzyme yan madalas. Okay, so itong mga to, ang tinatawag natin sa kanila is cardiac markers. Okay, cardiac markers. Pag sinabing cardiac markers, ito yung mga enzyme na kung saan tumataas siya pag nadadamage yung heart. Same with your creatine kinase and or creatine kinase. Okay? Ito kasi class, kaya siya merong CK lang dyan and CKMB. Meron kasi tayong iba't ibang uri ng creatine kinase. Okay? So, ang isang uri ng creatine kinase natin ay si CKMB. Okay? Kasi class, malalaman nyo, no, pag nasa clinical chemistry na tayo, na madaming uri itong creatine kinase. Okay? So, kung gusto mong malaman kung diretso ba sa heart yung source ng isang enzyme, specifically, dapat CKMB yung tingnan mo. Okay? And another thing is digoxin. So, si digoxin, eto class, pag sinabi natin digoxin, minomonitor natin yung digoxin ni patient sa blood. So, si digoxin, isa po siyang medication. So, itong medication na to is used to improve the strength and efficiency of heart. Okay, so si digoxin uses to control the rate and the rhythm of the heartbeat of our patient. Okay, so ini-improve niya yung pag-contract ng ating heart. So that's why kailangan natin i-monitor yung amount ng digoxin sa blood ni patient para ma-maintain yung therapeutic dose. Okay? Next class, we have the cholesterol. So, si cholesterol, na-discuss na natin siya, no? Nung diniscuss natin yung lipid profile. So, si lipid profile, ang isang parameter doon na tinitignan ay si cholesterol. So, si cholesterol, specifically si HDL at si LDL. So, si LDL, pag mas mataas yan, mas prone si patient sa heart attack. Whereas, pag si HDL mataas, more likely, it signifies that the patient, okay, has a lower chance to experience heart diseases. Okay. So, yan plus yung mga test na ginagawa to diagnose a heart disorder. Okay. So, ayan class, of course, we have the electrocardiogram, the ECG, okay, lactate dehydrogenase, yan, myoglobin. Ito class, no? Pag ACE yan, mga cardiac markers yan. Ibig sabihin, pag ang isang organ kasi class, nakaka-experience siya ng injury, nagre-release siya ng enzyme. Ang tawag doon, cardiac enzyme. Di ba class, pag sa liver, meron siyang injury, tapos nagre-release siya ng enzyme, ang tawag doon is liver enzyme. Okay? So, eto naman class, itong mga cardiac markers po yun, or cardiac enzyme. Ito, lactate dehydrogenase, myoglobin, and troponin. So, ito class, I just want to emphasize, since ang dami kong nabanggit na enzyme, pag tinanong ko sa quiz, what is the most specific type of enzyme that can be produced by the heart? The answer is the troponin. Okay, again, the answer is troponin. Troponin. Ito yung pinaka-specific na enzyme na makikita mo lang sa heart. Kasi class, for example class, no, etong si lactate dehydrogenase, same with your creatine kinase, yung mga yan, nakikita siya sa muscles. So, pag may muscle injury ka, other than the heart, kasi class, di ba ang heart made up of muscle? So, pag halimbawa, galing ka sa training, isa kang athlete, pag kinuhanan ka ng lactate dehydrogenase, same with creatine kinase, pwede ring tumaas itong mga enzyme na ito. Kasi hindi siya specific for the heart. Unlike si troponin na pinuproduce lang ng ating heart. Okay? So, I hope that's clear, no? Kaya ko yun binanggit kasi madami tayong type ng enzyme, okay, na cardiac marker. Pero yung ibang enzyme, hindi siya specific sa heart. May ibang organ na pwedeng mag-produce ng same enzyme. Whereas, pag si troponin, mataas sa blood ni patient, more likely may damage siya sa heart. Okay? So, I hope that's clear. Next is the triglyceride. Okay, so may connection to sa lipid profile. Okay, so nagbi-build up yung fats doon sa heart na pwedeng maging cause ng obstruction. Okay, next is potassium. So we all know that potassium is needed by our muscle to contract. Take note that our heart is made up of muscle, so therefore it also needs potassium. Okay, so yan yung mga test na ginagawa natin to diagnose for heart disorder. Okay, so now class, let's proceed to the main division of the vascular system. So when we say vascular system, it is the loop that consists of a system of blood vessels through which blood is circulated to the rest of the body. We have the pulmonary circulation and we have the systemic circulation. So pag sinabi natin pulmonary circulation, ito siya class. Yung pag-ikot ng blood papunta sa lungs para kumuha ng oxygen or ibigay si carbon dioxide. Class, di ba pag nag-e-exhale tayo, nagre-release tayo ng carbon dioxide when we are breathing. So yung carbon dioxide na yan, galing yan sa red blood cells na dineliver niya papunta sa lungs. Okay? So pag dineliver na ng RBC si carbon dioxide, kukuha naman siya ng oxygen pabalik sa heart para i-deliver all throughout our organs. Okay? Okay. And yung sa systemic circulation naman, class, is involved dun yung heart na magde-deliver naman ng oxygenated blood papunta sa organs and ang deoxygenated blood papunta sa lungs. Okay. So, meron tayong dalawang circulation. Okay. Now, let's discuss the structures of the vascular system. Okay. So, we have here the arteries. When we say arteries, it is a thick-walled blood vessel that carry oxygen-rich blood from the heart, okay, to the tissues of the body. Okay, so si arteries, siya yung merong pressure. Okay, meron siyang pressure kasi nga siya yung nagpapump papunta na siya yung nagpapump ng oxygenated blood papunta sa organs. Okay? Si arterioles, maliliit na arteries. Okay? So, it is a small diameter blood vessel that branches out from the arteries that leads to the capillaries. Okay? So, si capillaries, dyan nangyayari yung exchange of gases, specifically carbon dioxide and oxygen. Okay? Next, we have the veins. So, veins are the tubes with thin walls that carry the oxygenated blood or carbon dioxide-rich blood from the tissues to the heart. Okay? And meron kang venules dito, maliliit na vein, na kung saan na kinoconnect niya yung vein sa capillaries. Okay? So, kumbaga class, no, si venules tsaka si arterioles, okay, kinoconnect niya sa capillaries na kung saan doon nangyayari yung carbon dioxide and oxygen exchange. Okay? Capillaries are fine hair-like blood vessel that connects the arterioles and the veins. Okay? So, ito class, ito yung ating capillary. Okay, nandito yung capillary. So, si capillary, bago mag-capillary, meron ka munang venules and arterioles. Okay? Next class, let's discuss the types and structures and functions of the blood vessels. Okay? So, ito class yung mga iba't ibang uri ng blood vessels. No? Yan class. Ngayon, let's discuss their structure. Meron silang tatlong layer. So, we have here the tunica adventitia. So, when we say adventitia, it is the outer connective tissue. Tunica media, it is the middle, as the name implies. Media, it is made up of muscles and elastic fiber. Kaya nga, class, yung blood vessel natin, meron siyang capability na mag-stretch kasi meron siyang elastic fiber. And meron siyang capability na mag-pump ng blood kasi meron siyang muscle. Okay, so yung blood vessel natin, it is made up of smooth muscle. Okay, class, remember, meron tayong tatlong uri ng muscle. Cardiac, skeletal, and the smooth muscle. Okay, so si blood vessel natin, it is made up of your smooth muscle. And the last layer is the tunica intima. As the name implies, intima means inner. It is made up of endothelial cells. Okay? And we have here the lumen and you have the valves. Okay? So, yan yung different structures ng ating blood vessel. Okay, so ito class, let's discuss the flow of blood. Okay? So, yun class, basahin nyo na lang to, no? Mag-focus ako dito sa picture. Okay? So, kung ano itong mga nandyan na words, i-discuss na lang natin dito sa picture para mas maintindihan natin. Si superior vena cava at si inferior vena cava, ang laman niyan is deoxygenated blood. Okay? So, si deoxygenated blood, pupunta yan kay right atrium. Okay? Si right atrium, yung blood na deoxygenated blood, dadaan muna siya kay tricuspid valve. Okay? So, pag nagsara si tricuspid valve, pupunta na siya kay right ventricle. Okay? So, pag nandyan na siya kay right ventricle, dadaan naman siya kay pulmonary semilunar valve. Okay? Papunta kay pulmonary trunk. So, magsasara na si pulmonary semilunar valve. Okay? So, sino na ang kadugtong nito? Okay? Sa lungs, meron tayong pulmonary arteries. As I said earlier, sa lungs nangyayari yung exchange ng gases. Specifically, pulmonary capillaries. So, yung dala niyang carbon dioxide, ibibigay niya na kay lungs and kukuha na siya ng oxygen. Okay? Pag oxygenated blood na siya, babalik na siya sa heart. Okay? So, si oxygenated blood, papasok siya kay pulmonary veins. Okay? May dala na yung oxygen. Okay? Pagkapasok kay pulmonary veins, dadaan na siya kay left atrium. Si left atrium, dadaan na yung blood kay mitral valve. Okay, dito kay mitral valve. Pagkadaan niya kay mitral valve, dadaan na siya kay left ventricle. Okay? Pagkadaan niya kay left ventricle, dadaan na siya kay aortic semilunar valve. Then, papunta kay aorta. Magsasara na si aortic semilunar valve, papunta kay aorta. Sino kadugtong ni aorta? Siya na po yung magpapamigay all throughout the tissues of different organs of the body. Pag nagamit na uli yung oxygen ng blood, pag nagamit na si oxygenated blood, babalik na po yan as deoxygenated blood, then the cycle continues. Class, take note ha, simultaneously nagko-contract yung dalawang side ng heart. Baka iniisip nyo, ay ito munang left side, antayin ko muna. So, ito, ibig sabihin ba walang laman yung right side ng heart habang nagpupuno pa siya ng oxygenated blood? No. Simultaneous yang nangyayari. Okay, simultaneous. Parehas nagko-contract, parehas nagtatrabaho si right and left side of the heart. Okay? So, ganun lang siya, class. No? So, ito, ilalagay ko to sa quiz, obviously, then paki-memorize yung sequence. Sino yung susunod na mag-open, sino yung magko-close, anong chamber yung susunod, anong uri ng blood yung laman niya, oxygenated blood ba, or deoxygenated blood. So class, again, to sum up, so the deoxygenated blood will go through the superior vena cava and inferior vena cava. Okay? Then the oxygenated blood will go to the right atrium. After the right atrium, it will go to the right ventricle. So right ventricle and right atrium, okay, they have a valve on their middle and it's called tricuspid valve. Okay, so this tricuspid valve. Then after that, once the deoxygenated blood is in your right ventricle, it will now go to the pulmonary trunk, okay, via this valve. So what do you call this valve? This is pulmonary semilunar valve. Okay, this is the valve which opens to your pulmonary trunk. So this pulmonary trunk is connected to the capillaries that is found or that are found within the lungs. Okay, then once the oxygenated blood is present, okay, it will now go to the left pulmonary veins. Okay, pulmonary veins, then it will go to the left atrium, okay, left atrium, then left ventricle, then in the middle of left atrium and left ventricle, you have here your bicuspid valve, okay, bicuspid valve, or also known as your mitral valve. And after that, it will go to your mitral valve, then you also have here another valve, which is called the aortic semilunar valve, okay, which opens to the aorta, okay. So this aorta, okay, It has several branches, so that branches will branch out to deliver in several organs. No? So the oxygenated blood will be delivered into several tissues of the organs. Okay, so yan lang class, no? So, class, be particular doon sa color kasi yung color blue, it signifies the oxygenated blood, whereas the color red signifies oxygenated blood. Okay? So class, now let's proceed to the disorders that you can encounter in the vascular system. Okay, so in here we have aneurysm. Aneurysm is the enlargement of artery due to the weakening of the artery wall. Okay, so nagbabulge siya no, or nagsiswell. Okay, then kaya nga yung iba class, pag nag-explode yan, yung artery mo, naglilid siya sa stroke. Okay? Next is arteriosclerosis. Okay, so this is the hardening of the arterial wall due to aging. Okay. Next, atherosclerosis is the plaques in the inner walls. More likely, this atherosclerosis is formed by the cholesterol or the fats that are stuck in the arterial walls. No? So, yun class. So, pag merong lipids or may fats doon sa blood vessel, syempre, nagiging cause yun ng pagbaba, okay, or pagbara, pag-obstruct doon sa blood flow papunta sa heart. Okay? Next is embolism. So, when we say embolism, it is a clot or bubble which cause obstruction of an artery. So class, take note, embolism, minsan nanggagaling yan sa isang thrombus. Okay? So, meron kang embolus, okay, na galing sa isang thrombus. So, class, ang nangyayari kasi, mag-drawing tayo na. So, for example, class, ito yung iyong blood vessel. Ngayon, dito, meron kang thrombus. Thrombus yan. Ngayon, itong thrombus na to, pag merong yung part na kung saan na-break, so for example, na-break yan into 2 or na-break yan into 4, basta nag-break siya, parang nabasag siya sa madaling salita, yung part niyan, okay, yung mga parts nung nasirang thrombus, okay, that is called your embolus. Okay? So, yung mga yan, embolus yan. Yung mga parts na galing dun sa thrombus, no? So, ayang embolus na yan, pwede yan mag-travel at bumara sa iba't ibang parts ng artery, no? Iba't ibang organ or iba't ibang location ng artery. So, yan yung class. Yan nga, sabi ko kanina, embolus is an obstruction that is carried and lodged in a vessel. Okay? Whereas hemorrhoids, swollen veins naman, no? Specifically in the area of the anus. Okay? Next is phlebitis. So when we encounter the word itis, it means inflammation. So phlebitis means inflammation of the veins. Okay? So ito class, for example, pwedeng maging isa to sa mga complications when it comes to phlebotomy. Nagkaroon ng infection dun sa venipuncture site, nagkaroon ng phlebitis yung ating pasyente. Okay? So dapat kaya nagdi-disinfect tayo lagi. Okay? Thrombophlebitis is a swelling of veins of the legs that usually occurs during pregnancy. Okay? So, klase thrombophlebitis, iba pa siya sa edema. Okay? Iba siya sa edema class ha. Kasi pag sinabing edema, manas. Okay? Pag sinabing thrombophlebitis, it is swelling of the veins of the legs. Okay? Next is thrombus. It is a blood clot that impedes blood flow. Okay? So, ang pinagkaiba nila ni embolus, si thrombus, siya yung clot na hindi gumagalaw. Okay, nakasettle na siya sa isang location, whereas si embolus, siya yung parts na galing dun sa thrombus mo, na nagta-travel sa iba't ibang location ng blood vessel, mapa-artery man yan, or mapa-vein. Okay? Lastly, we have here the varicose veins. These are usually found in the legs. Okay? These are the veins that have been twisted and have enlarged. So, ito klase varicose veins. Mapapansin nyo class, no? Makikita nyo to sa mga pregnant women after nilang manganak, no? Or basta nagbuntis ang isang babae. Kasi class ganito. Si varicose vein, ang isang cause niyan is yung mabigat yung weight mo, tapos binibear niya lahat yung weight mo sa legs. Okay? So that's why minsan na-enlarge siya. No? Kasi yung pressure dinadala niya from the weight of the upper portion of the body. Okay? So yan class. Okay. Next class, let's proceed to the diagnostic test of the vascular system. Okay, so we have D-dimer, FDP, lipoproteins, triglyceride PT, and PTT or APTT. Okay. So class, si D-dimer at si FTP, itong mga test na ito are mga blood tests that measures if the patient is currently suffering from a clotting disorder. Again, D-dimer and FDP are tests that are being measured if the patient shows signs and symptoms of a blood clotting disorder. Okay? So, yun class. Whereas lipoproteins and triglycerides, ito class tinitignan if mataas tong mga to sa patient's blood, it may be a cause of the obstruction of blood flow. Sila kasi nagiging cause ng atherosclerosis. Okay? So, pag may plaque, pag may bara, syempre nagiging cause ng obstruction ng blood flow. Okay? Whereas PT and PTT, ito class ha, hindi to si pregnancy test. Baka iniisip nyo class, si pregnancy test ito. Class itong si PT, prothrombin time yan. PT and PTT, itong dalawang to, they measure or they identify the presence of your clotting factors. Okay, so ayan class. So ito class, no, yung deeper discussion about PT and PTT, D-dimer and FDP, you will all discuss that during your hematology. Okay, pagdating yun ng 3rd year. Okay? So next class, let's proceed to the major constituents and functions of the blood cell. So it says here that the blood is the red fluid that is transported all throughout the body through the circulatory system. Okay, so we have the arterial blood and we have the venous blood. So class, dito, ito nga sabi ko kanina, we have here the blood vessel. So sa blood vessel, you have 3 layers. You have the intima, media, and the adventitia. Okay? We have the blood cells, the red blood cells, WBC, platelets, and plasma. Class, bakit kaya ang tawag sa liquid portion ng blood inside our body is plasma? Bakit hindi serum? Remember that unclotted blood, the portion or the liquid portion of unclotted blood is called plasma. Siyempre class, yung blood na nasa loob ng katawan mo, hindi naman yan clotted. So meaning, plasma yan, hindi yan serum. Okay? So the human blood composed of plasma and other formed elements. It contains gases, okay, minerals, carbohydrate, lipids, and proteins. Okay, so when we say plasma, it is a clear, straw-colored liquid portion of the blood, and it is 90% water. Okay, the 3 components we have here: the erythrocyte, leukocyte, and thrombocyte. So ito class, review lang ulit, di ba? Na-discuss na natin to doon sa discussion natin sa laboratory. Okay? So blood type, the human blood type is inherited and determined by the antigens of the surface of our red blood cell. So as I said on our last discussion, the antigens that you possess, okay, signifies your blood type. Okay? If the patient possess A antigen, ibig sabihin, blood type A siya. If the patient possess B antigen, ibig sabihin, blood type B siya. Pag may A and B sa kanyang antigen, AB ang kanyang blood. Whereas, if neither A nor B are present, O yung kanyang blood type. Okay? And we have the RH blood group, which signifies the positive or negative when we are stating our blood type. Okay? Okay, so dito na tayo class kasi alam niyo na to na-discuss na natin yan. So ito class, ulitin lang natin na pag si patient may A antigen sa kanyang RBC surface, A yung kanyang blood type. Whereas sa kanyang plasma, may anti-B. Okay, meron siyang antibodies against B antigen. Okay, kaya nga class importante na pag nagtatransfuse ka ng blood sa isang recipient, okay, dapat compatible yung blood type ni recipient and ni donor. Okay? So, yung blood na pwedeng ma-receive ng isang tao na may blood type A ay A and O. Okay? So, i-analyze natin, class. Okay. So, dito, class, ang sabi, ang antigen niya sa RBCA. Ibig sabihin, ang antibody niya sa kanyang plasma ay anti-B. Ngayon, class, imagine niyo na lang, hindi pwedeng maging anti-A ito for the reason na aatakihin niya yung kanyang sariling antigen. Okay? Guys, remember that you form antibodies to the antigens that you lack. Again, you form antibodies to the antigens that you lack. Okay? So, ibig sabihin, kung wala kang B antigen, automatic meron kang anti-B. Okay? So, since ang antigen na meron ka is A, may anti-B ka. Okay? Again, you form antibodies to the antigens that you lack. Nagpo-form ka ng antibodies doon sa mga antigen na wala ka. Okay? So, that's why ang pwede mong ma-receive na blood is from A, okay, blood type A donor, and O. Bakit A? Kasi compatible kayo. Parehas kayo ng antigen na meron and at the same time, meron din siyang anti-B. So, walang transfusion reaction na mangyayari. Next, bakit naman si O? Bakit naging pwedeng i-transfuse si blood type O kay A? Okay. So, class, para mas specific tayo ha. Ganito. Madami kasing component ang blood na pwedeng i-transfuse sa isang pasyente. Ngayon, etong mga nakasulat dito, etong mga blood type na pwede mong i-transfuse sa isang pasyente para specific tayo sa component, PAC-RBC. Okay. Etong mga to, PAC-RBC. Okay. PAC-RBC, walang kasamang plasma. Okay. PAC-RBC, walang kasamang plasma. Okay? So, ngayon, punta tayo kay O. Ngayon, si blood type O, si RBC-O, okay, pwede mo siyang i-transfuse kay A for the reason na yung antibodies ng isang pasyente na A ang kanyang blood type, wala naman siyang antibody against the O antigen. Kasi wala naman talagang O antigen. Tinatawag lang siyang O to signify the absence of A and B antigen. Okay? So, ganun siya, class, no? So, si blood type O pwedeng ma-receive ni blood type A. Okay? Kasi, wala siyang antigen na present. So, si anti-B, wala siyang aatakihin or wala siyang ibabind. Kasi wala namang antigen si O. Ito, class, para mas malinaw. Paano kung si blood type A, nag-transfuse ka ng blood type B? Si blood type B, sa RBC surface niya, may B antigen. Eh si patient na ang blood type niya ay A, meron siyang anti-B. So si anti-B, pag nag-transfuse ka ng blood na kung saan merong B antigen, magbabind silang dalawa and it will form agglutination and will cause transfusion reaction to the patient. Okay? So, next. How about naman, class, pag B? Pag ang blood type ng patient natin ay B, meaning yung antigen sa surface ng RBC niya is B antigen. So, in his body, the present antibody is antibodies against A antigen. Again, you form antibody to the antigens you lack. Wala kang antigen A, therefore, you will form antibodies against A. Okay? So that's why the PAC-RBC that you can receive or the patient can receive is from a donor who has a blood type B and blood type O. Okay? Bakit B? Okay, kasi pag nag-transfuse ka ng same blood type, ibig sabihin, parehas lang kayong ng merong B antigen. Okay? Next, pag sinabi natin O, bakit nandyan na naman si O? Okay? Kaya nga klase O, ang tawag sa kanya is universal donor. Kahit kanino, pwede siyang mag-donate. Take note, yung kanyang PAC-RBC. Again, PAC-RBC. Okay? RBC lang yung idodonate mo. Ngayon class, tignan natin bakit kaya pwedeng i-transfuse si blood type O kay B patient. Kasi class, tignan natin yung antigen ni patient O, okay? Wala siyang antigen, di ba? So pag nilagyan mo si patient na blood type niya ay B, okay? Si anti-A wala siyang ibabind kay RBC na walang antigen. Kasi wala naman siyang laman. So, sino ang i-aatakihin no? Anti-A mo? Wala. Okay? So, that's why pwede mong i-transfuse si O kay blood type B. Whereas, pag ang patient natin merong both A antigen and B antigen, wala siyang antibodies against anti-B and A. Okay, wala siyang antibodies na present. Wala siyang antibodies against anti-A and anti-B. Bakit? Kasi class, kung lalagyan mo yan ng anti-B at anti-A, edi magbabind yan sa kanyang sarili and it will cause transfusion reaction. Okay? So that's why si AB patient, ang tawag sa kanya is universal recipient. Meaning, this patient can this patient can receive several blood types. Okay? It can receive A, B, AB, and O. Bakit? Kasi wala namang antibodies. Kahit mag-transfuse ka dyan ng B, mag-transfuse ka dyan ng A, mag-transfuse ka ng B, okay? Wala siyang ibabind kasi walang present na antibodies. Ma'am, bakit nga wala ulit present na antibody kay AB blood type na patient? For the reason na pag may present dyan na anti-A at anti-B, meron ka ngang antigen A at B. Di doon magbabind si anti-A, anti-B, and it will cause transfusion reaction. Mamamatay ang pasyente mo. So that's why wala siyang antibody. And as I said earlier, you form antibodies to the antigen you lack. Wala ka namang nilalak na antibody because you have A and B antigen. Okay? Bakit kaya siya universal recipient? Kasi nga po, wala siyang antibodies. Kaya kahit anong RBC, pwede niyang tanggapin. Okay? Next, how about Tito K, blood type O? Si blood type O class, kung mapapansin nyo, meron siyang both antibodies to A and B for the reason na wala siyang antigen. As I said earlier, you form antibodies to the antigen you lack. Wala siyang A and B antigen. Therefore, yung body ni patient magpo-form ng anti-A and anti-B. Okay? So that's why sa serum ng ating patient, I mean sa plasma rather, sa plasma ng ating patient, meron siyang anti-A and anti-B. Kasi wala naman siyang antigen in the first place. That's why ang pwede niya lang matanggap na blood is blood type O. Okay? Kasi class, kung lalagyan mo siya ng blood type A, hindi pwede kasi may anti-A siya. Lagyan mo siya ng blood type B, hindi pwede kasi may anti-B siya. AB, hindi pwede kasi may anti-A and anti-B siya. So, ibig sabihin, si O lang yung ating pwedeng i-transfuse kay patient O. Okay? So, ganun siya, class. No? Kaya si blood type O, It is called the universal donor kasi lahat ng blood type pwedeng tumanggap ng O. Whereas, si AB, ang tawag naman sa kanya is universal recipient kasi ang isang pasyente na kung saan ang blood type niya is AB, kahit anong blood type pwede niyang i-receive. AB, AB, and O. A, B, AB, and O. Okay? So, lahat ng blood type pwedeng ma-receive ng isang patient na ang blood type niya is AB. Whereas, si blood type O, pwede siyang mag-donate sa lahat ng uri ng blood type for the reason na wala siyang antigen. Okay? So, I hope that's clear. Okay? So now class, let's talk about whole blood, serum, and plasma. So ito class, tong portion na to, di ba na-discuss na natin siya sa first laboratory meeting natin. Okay? Yung difference ng whole blood, serum, and plasma. So pag sinabi nating plasma, it is the liquid portion of the unclotted blood. Serum, liquid portion of the clotted blood. Okay? The whole blood consists of the red blood cells or the formed elements, the white blood cells, platelets, thrombocytes, and the plasma or serum. Okay? So when we say buffy coat, so ito class, after centrifugation, pag nag-separate na yung formed elements, okay, yung red blood cells, tsaka yung liquid portion, yung nasa middle portion nun, that is what you call buffy coat. Then buffy coat consists of your white blood cells and platelets. Okay? So now let's talk about the blood disorders that you encounter in the blood. Okay, so anemia, it is caused by not having enough RBC or hemoglobin. So dati, di ba, diniscuss natin na without hemoglobin, red blood cells cannot perform their function. Okay, so the red blood cells must have hemoglobin to be able to perform their function. Okay, so next is leukemia. So leukemia is the cancer of the blood. Okay, next, class, when we say leukocytosis, the patient is currently suffering from an infection because his WBC is increased. Okay, so di ba diniscuss natin, when WBCs are increased, the patient is currently suffering from an infection. Okay, leukopenia naman, pag masyadong mababa si white blood cells. Okay, polycythemia, when we say polycythemia, the marrow produces too much red blood cells. So, ang nangyayari dito, the blood thickens too much. Okay? Blood thickening. Okay? Next is thrombocytosis. So, when we say cytosis, may increase thrombocyte platelets. So, meaning the body produces or the body has an overwhelming amount of platelets. Okay? Which affects the blood clotting. So class, imagine niyo pag mataas masyado yung ating platelets, ibig sabihin si patient nagiging prone naman siya sa blood clotting. Remember that platelets function is to aid in the clotting of blood when there is an injury to the blood vessel. Okay? Ngayon, pag sobrang dami ng platelets mo, prone ka naman sa clotting. Hindi rin naman maganda yon. Kasi pag madami kang clot, pwedeng mag-impede or mag-obstruct ng blood flow yung clot na yon. Okay? So, dapat si clot, once okay na yung injury, na-dissolve siya. Okay? So, later on, i-discuss natin kung paano ba na-dissolve ang clot. Okay? Next, when we say thrombocytopenia, ito naman yung condition na kung saan mababa or merong reduce, decrease platelet count ang pasyente. Okay? Okay. So now, let's talk about the diagnostic tests for blood disorders. So we have bone marrow examination. Okay? Next, we have CBC. Okay, so CBC, di ba class, na-discuss na natin siya. Meron siyang hematocrit, hemoglobin, diff count, and different indices for your RBCs. Okay? Next, we have ESR or erythrocyte sedimentation rate. Class, when we say ESR, it is a test to know if the patient is suffering from an inflammation. Ang pangit lang kay ESR, hindi siya specific. It will not tell you what kind or what specific type of infection or inflammation the patient is currently having. Okay? So it will just tell you may inflammation si patient. Okay? Next is reticulocyte count. Take note, reticulocyte count is an abnormal cell. Okay? So ito si reticulocyte, isa siyang immature cell. Okay? Immature cell na RBC. Kasi class, si RBC may stage by stage development yan bago siya mag-fully mature. So ngayon, si reticulocyte, isa siyang step bago mag-fully mature yung RBC. So sa madaling salita, reticulocyte is still an immature RBC. So when reticulocytes are present in the bloodstream, it means there is an abnormality because the RBC that should be present in your bloodstream is the mature one, not the immature one, because the immature one cannot perform the function of a mature RBC. Okay? So reticulocyte count, pag mataas yan, ibig sabihin madaming immature RBC ang present sa bloodstream. So si patient baka may anemia. Okay, so yun class. Next is the ABO and RH type. So dito class, ito yung tinatawag nating blood typing. So we perform blood typing before we can cross-match the donor's blood and the recipient's blood. Okay, so i-cross-match mo. Siyempre, paano mo i-cross-match kung hindi mo alam yung blood type? So the patient or the medtech rather should perform blood typing first before the medtech can proceed to the cross-matching. Okay, next, ferritin, iron, and TIBC. This test measures the amount of iron, okay, in the RBC. Okay, so ito yung mga test na yan. So ito class, yan yung mga common test na ginagawa to diagnose a blood disorder. Now let's proceed to the lymphatic system. Okay, so the lymphatic system of the human body is made up of network tissues and organs that is responsible for the removal of toxins and waste in the body. Okay, the main function or the primary function of our lymphatic system is to transport white blood cell to the site of infection from the lymph node. Okay, all throughout the body. Okay, take note, lymphatic system is a part of your immune system and a complementary system for your circulatory system. So when we say complementary, they support each other. Okay, they complement. Okay, so the structure of the lymphatic system is composed of fluids or lymph. Okay, so yung fluid na nagpo-flow inside our ducts, lymphatic duct, is called the lymph. Okay, so lymph is similar to plasma, but it consists of 95% water. Okay, the lymph is transported throughout the system to the lymphatic vessels, ducts, okay, and masses of lymph tissue, okay, called the lymph nodes. Okay, di ba may mga lymph nodes tayo, class, no? Nagpapansin nyo, class, when we have an infection, inflammation, our lymph nodes is swelling. Okay, our lymph nodes swell when there is an inflammation or infection near that area. Okay. Okay, so we have different lymph node or lymphatic system, okay, lymphatic organs in our body. Okay, we have the tonsils, the thymus, yeah. Okay, appendix. Okay, so somebody or someone may say that appendix is an organ that is usually removed, okay, because it doesn't have a function. Okay, so you are wrong because appendix aids, okay, when there is an infection. Okay, it is considered as a lymphatic organ. Okay, so it is very wrong to say that appendix is a useless organ. Okay? So, what else? Ano pang function ng ating lymphatic system? Okay? So, lymphatic system transports back the tissue fluid to the bloodstream, removes impurities, okay? Process lymphocytes, okay? Development ng lymphocytes natin, and transports fats absorbed from the intestine to the bloodstream. Okay, so when we say lymph, it is an excess tissue fluid that filters into the lymphatic capillaries. Okay, so remember, capillaries are joined and form the larger vessels which empties into the right lymphatic duct. Okay, so di ba class na pag-usapan din natin si capillaries, okay, in the site of gas exchange. So si capillaries din yan, no? So si capillaries, a part of the capillaries is joined by the lymphatic vessels. Now let's talk about the disorders that you may encounter in the lymphatic system. Okay, so we have lymphangitis. When we say lymphangitis, may itis ka na naman dyan, meaning inflammation. So lymphangitis means inflammation of the lymphatic channels that results from an infection. Okay, so infection at a site distal to the channel. When we say distal, okay, it means a part of the channel is currently having an infection. Okay, and that channel is now inflamed. Okay, next, when we say lymphadenitis, it refers to the inflammation of the lymph nodes naman. So when the inflammation happens all throughout a lymphatic channel, it is called lymphangitis, whereas when lymph nodes are the ones that is inflamed, it is called lymphadenitis. Okay. Lymphadenopathy, also called adenopathy, is a disease where there is an abnormality of the size or number of lymph nodes. Okay, so lumalaki, okay, yung lymph node. Next, splenomegaly, it means enlargement of the spleen. Okay, splenomegaly, lumalaki si spleen. Remember, spleen is a lymphatic organ. Okay. Next, Hodgkin's disease is a cancer of the immune system. Okay. So, ang isang characterization or ang isang manifestation ng Hodgkin disease is enlarged lymph nodes. Okay. So, enlarged lymph nodes, pwede nating sabihin meron siyang lymphadenitis. So, Hodgkin disease, one of the symptoms that you have an Hodgkin disease is you are currently suffering from lymphadenitis. Okay. Inflammation of the lymph node, or the lymph nodes are enlarged. Next, when we say lymphosarcoma, when we say sarcoma, it is a cancer. Okay, so it is a type of cancer that develops from the lymphocytes. Okay, and lymphoma, again, it is a cancer that begins with the lymphocyte also. Okay, so lymphoma and lymphosarcoma are cancers that involves the lymphocytes. Okay, remember, lymphocytes develop in your lymph nodes or in the lymphatic organs. Okay, so what are the tests that we can use to diagnose a disorder of the lymphatic system? We have the bone marrow biopsy, CBC, okay, culture and sensitivity. Bakit culture and sensitivity? To know if the patient is currently suffering from an infection. Okay, and lymph node biopsy and mononucleosis test. Okay, so ito klase mononucleosis test, nagdina-diagnose niyan if the patient is currently suffering from cytomegalovirus or the CMV. Okay, so yun class yung lymphatic system natin, no? So now let's proceed to the hemostasis, basic coagulation, and fibrinolysis, or the solution of the clot. Ito na nga yung sinasabi ko kanina, that the clot doesn't have to stay forever in your blood or into the site of injury. At some point, it should be dissolved. Okay, because if the clot stays in the injury or into the site of injury, it will block or it will cause an obstruction to the blood flow. Okay, so hemostasis is the stoppage of bleeding as a response to an injury. Okay, so hemostasis. There are 4 interrelated responses to your hemostasis. Vasoconstriction, when we say vasoconstriction, the constriction of the blood vessels. Next is the formation of the platelet plug. Okay, and progression to the stable blood clot and the dissolving of the clot. Okay, so yan yung 4 steps natin to maintain or to achieve your hemostasis. Okay? So coagulation or clotting is the process where the blood changes from liquid to form into the gel that forms a clot. So clot, coagulation, they are there to stop an injury to bleed. Okay, so di ba class, when you have an injury, pag may sugat ka, hindi naman yan forever nagbi-bleed. Di ba? Pag meron tayong sugat, may injury tayo, pag nag-bleed yan, at some point, titigil din yung bleeding. Okay? Because meron tayong tinatawag na coagulation and yung pagkaklat ng blood para hindi magdugo ng magdugo. Okay? So, there are 3 types of your coagulation factors or clotting factors. We have the enzymes, precursor, we have the cofactors and the substrates. We have the pathways, extrinsic and intrinsic pathway. So ito class, dadaanan natin or i-discuss natin briefly yung mga coagulation factors. Di ba sabi ko class, si coagulation factors, clotting factors, they are very essential when it comes to the coagulation of blood or to the formation of the stable blood clot in your injury. Okay? So kasi class, dapat ang clot na mag-form doon sa site of injury natin is stable. Okay? Para magampanan niya yung function niya, okay, to aid in the healing of the blood vessel. Okay, kasi kung hindi yan stable, pwede yan maalis at mag-bleed ulit yung injury. Okay, so that's why the patient should have a complete factors, complete coagulation factors. Okay? Okay, so class, ito yung ating tinatawag na clotting factors. So, nakakakita kayo dyan ng madaming numbers kasi yan yung name ng mga clotting factors natin. Though meron silang other names, pero ang common name na ginagamit natin sa kanila is by their numbers. So we have here factor 7 can be activated into 7A pag merong triggering factor na nangyari, which is the tissue damage. Pag nagkaroon ka ng blood vessel injury, tissue damage, si factor 7, magiging 7A siya. Ma-activate siya sa 7A. Then si factor 7A, eventually, i-activate niya si factor 10 para maging 10A. Okay? Then si 10A, factor 10A, i-activate niya si factor 2 para maging factor 2A. Okay? Then si factor 2A, pag nandyan na siya, i-activate niya si factor 1 para maging factor 1A. Okay? So, ganun yung process niya, class. Then, hindi lang ito. Okay? Hindi lang to class. Kasi ang tawag natin dito, meron tayong tinatawag na intrinsic and extrinsic pathway. So, itong si extrinsic pathway, ganito siya. Dito yung portion na yan. Ito yung extrinsic pathway. Ito yung portion ng intrinsic pathway. Okay? So, si intrinsic pathway, pag na-trigger siya ng damaged surface, ito yung triggering factor niya, it will activate factor 12 into 12A, then 12A eventually will activate factor 11 to 11A, then 11A will eventually activate factor 9 into 9A. Okay? Then 9A will eventually activate factor 10 to 10A. So that's why this part of the clotting factor is called common pathway. Okay? Bakit siya common pathway? Kasi si intrinsic pathway at si extrinsic pathway, dito siya nagmi-meet. Okay? Ito yung common kay intrinsic at kay extrinsic pathway. That's why it is called common pathway. So that's why class, ang end result nito is magpo-form ka ng stable blood clot. So imagine class, paano kung kulang ka nito? Okay, paano kung kulang ka ng factor 10? Pag kulang ka ng factor 10, paano pa magpo-proceed itong pag-form mo ng stable clot? Okay, so yun yung point nito class, no? So ito class, I will not require you to memorize this pathway as early as now. Hindi ko siya ipapamemorize muna sa inyo kasi meron kayo nito sa hematology. Okay, meron kayong ganito sa hematology. Pag-uusapan nyo ulit ito sa hematology. Dito, iikot lalo yung hematology 2 nyo. Okay, kasi may hematology 1, may hematology 2. So sa hematology 2, puro ganito yung pag-uusapan nyo. Anong gagawin pag may kulang na factor? Paano ma-identify? So on and so forth. So pag nakapag-form ka na ng stable blood clot, okay, let's say, okay na yung injury. Kailangan mo pa ba ng clot pag okay na yung injury? Of course not. Okay? So that's why, ang susunod na mangyayari is fibrinolysis. Okay? When we say fibrinolysis, this is where the fibrin or the clot is dissolved. Okay? So, yun siya, class. So, pag-usapan natin muna si thrombin. Okay, so si thrombin, it is an enzyme that plays an important role in coagulation. It amplifies coagulation, converts fibrinogen to soluble fibrin. Okay, so si thrombin supports the platelet plug formation by activating factor 13 to form a cross-linked fibrin or stable clot, and also it controls formation and coagulation process by activating protein C. Okay, so dito binanggit lang yung mga essential role or yung essential function ni thrombin. Okay, so si thrombin essential siya to form a stable clot. Okay, so yan siya yung sinasabi nating cofactors. Okay, cofactors. Okay. So class, when a vessel is damaged, the blood vessel will cause to spasm or the vascular will constrict or the vessel will constrict. Kaya nga ang tawag is vascular spasm. So bakit nagko-constrict? Para bumilis yung blood flow. Pag bumilis yung blood flow, yung mga cells na kailangan natin to block this injury will go to the injury site faster. Okay, kasi pag nag-constrict ang blood vessel, bibilis yung blood flow. So, bumibilis yung blood flow para yung mga cells na kailangan natin to block or to stop the injury will go faster to the site. Okay? So, yan. So, in here, bumalik na sa tamang flow, hindi na nakaspasm or hindi nakakonstrict yung blood vessel kasi meron na tayong platelet plug formation. Okay? So, pag may platelet plug ka dyan, then eventually, ma-activate na rin yung ating clotting factors. Okay, may platelet plug ka dyan, take note, hindi pa to stable. So, syempre, kailangan natin yung clotting factors to form a stable clot. So, kunwari, na-activate na lahat ng factors natin. May fibrin clot ka na. So, meron ka ng stable clot in here. Okay? So, ibig sabihin ba, forever na yan dyan? Of course not. Okay? So that's why we need fibrinolysis or the dissolution of clot. Okay? So dissolution of clot, in here, the one that is involved is a plasminogen and plasmin. Okay? So we need plasminogen and plasmin to dissolve the clot. Okay? How about the liver? Ano namang function ng liver when it comes to hemostasis? Remember that all these clotting factors are proteins. Take note, proteins came from our liver. So the major function of our liver is to manufacture protein. So that's why, pag si patient meron siyang liver injury, pwede siyang mag-suffer sa bleeding, no? Kasi yung clotting factors niya hindi na enough kasi si liver sira na. Okay? So the liver's role in hemostasis is to synthesize coagulation factor such as factor 5, factor 8, prothrombin, and fibrinogen. Okay, so this organ produces heparin and bile salts that are needed for synthesis. Okay? So si heparin, yan na yung ating natural anticoagulant inside our body. Okay, heparin. It is also responsible for the production of bile salts that needed for vitamin K absorption. So, bakit napasok si vitamin K dito? Take note, vitamin K is a cofactor. So, pag sinabing cofactor, kailangan siya para ma-activate yung certain type or certain coagulation factors. Okay, so cofactor siya. So, kailangan mo ng vitamin K. So, si vitamin K, kailangan niya si liver. Okay? So next, let's discuss the hemostatic disorders. Okay? So we have here the deep vein thrombosis. or the DVT. This happens when the blood clot forms in one or more deep veins, usually in the legs. Okay? Pag may clot daw na form doon sa mga veins natin, no? Usually nakikita daw yan sa legs. Okay? Disseminated intravascular coagulation, also known as DIC. So ito, si patient, ang nangyayari sa kanya, nagpo-form siya ng spontaneous blood clots. Okay? That blocks the small blood vessels. Okay? So when we say hemophilia, this is a disorder that involves lack of sufficient blood clotting proteins. So that's why we have hemophilia A, hemophilia B, and hemophilia C. Okay? So pag sinabi natin hemophilia A, the missing clotting factor is 8. Okay? Hemophilia B, pag ang missing clotting factor is 9. Okay? And when we say hemophilia C, the missing clotting factor is 11. Okay? So, yan class. Hemophilia, ibig sabihin, there is a clotting factor that is missing. Okay? Hemophilia A, 8. Hemophilia B, 9. Hemophilia C, 11. Okay? Yun yung mga nawawala sa kanila. Okay? Next, when we say thrombocytopenia, penia means reduce, decrease. Thrombocyte means platelet. So, thrombocytopenia means low platelet count. Okay. So, what are the diagnostic tests for your hemostatic disorders? Yan, bleeding time. Titignan natin gaano katagal nagbe-bleed si patient and at the same time, clotting time. Gaano katagal bago mag-clot si patient. So, sa bleeding time and si clotting time, ginagawa yan lalo na if the patient is about to undergo operation. Okay. Next, D-dimer and factor assays. D-dimer class and FDP, di ba na-discuss na natin yan? And factor assay, when we say factor assays in here, we identify what factor is missing in the patient's blood. Okay. And platelet function assay, tignan natin dito, ano bang function ng platelet yung hindi nagagampanan ng maayos. Okay? So in here, we're going to identify what specific function of platelet is not functioning. Okay? Prothrombin time and partial thromboplastin time in here, we're going to identify which factor also is missing, which coagulation factors is missing. Okay? PT and PPT. And at the same time, with your factor assays. Okay, now class, let's proceed to the major arms and leg veins in venipuncture. Class, don't get me wrong ha. Pag nag-venipuncture tayo, ang priority area pa rin natin is yung antecubital fossa. Okay? So magsusort lang tayo sa ibang veins pag wala na tayong choice given the circumstances of the patient situation. Okay, so class, of course, antecubital fossa is our priority area. Okay, pag wala talaga dyan, dun lang tayo hahanap ng ibang area. Okay, so kailan ba natin hindi pwede gamitin yung antecubital fossa? For example, amputated yung both arms ni patient. Okay, both arms of the patient is may IV, naka-IV yung both arms niya. Okay, so ayun class, yun yung mga instances na hindi natin pwedeng gamitin yung arms or yung antecubital fossa ng ating pasyente. Okay, and class, antecubital fossa, also called the elbow pit, is a triangular area on the anterior of the elbow. So ibig sabihin, anterior, harap ng ating elbow, ibabaw ng ating elbow. Okay, it is the first choice of venipuncture site because there are several major arm veins called antecubital fossa which are close to the surface, and it is easy to see, locate, okay, and penetrate. Okay, so yeah, we have the cephalic vein here. Okay, we have here the basilic vein. Okay, and we have here the median cubital vein. So class, take note, ang first choice natin dito sa tatlong vein na to is syempre si median pa rin. Okay? Next is cephalic vein, First median, second cephalic, and last si basilic. Si basilic vein kasi, hindi natin siya masyadong ginagamit for the reason na masyado siyang malapit kay basilic artery. May artery na malapit kay basilic vein. So, minsan, pag ginagamit natin si basilic vein, baka hindi natin alam, nakapuncture para tayo ng artery. Next, we have here the H-shaped antecubital vein. So, meron pa rin tayong median, cephalic vein, and basilic vein. Iba lang yung orientation. Okay? So, klase cephalic vein naman, madalas siyang nakikita sa mga obese patient. Okay? Obese patient sa cephalic vein. Minsan, mas prominent pa si cephalic vein compared to your median cubital vein when the patient is obese. Okay. Other area, we have the arm, hand veins. Okay. So these are only used when the antecubital veins are not accessible. Okay. So these are the veins at the back of the hands. Okay. And class. We have the metacarpal plexus and the dorsal venous arch. Ito class. Next, we have the leg, ankle, and foot veins. So take note, it must not be used in venipuncture. Pero na lang kung wala ka na talagang choice, see to it pag mag-venipuncture ka sa leg, ankle, and foot veins, you have the permission of the physician. Okay? Kasi may complications tayo dito like thrombosis. Lalo na kung prone or susceptible sa thrombosis yung ating patient. Okay? So, ayun class. Next is the arteries. Take note, it is not used for routine blood collection. Take note, medtechs are not allowed to obtain blood from the arteries. Only respiratory therapists and doctors are allowed. Okay? Arteries or arterial blood is used to a test called arterial blood gas. So dito titignan kung enough ba yung oxygen, carbon dioxide, iba pang gases sa blood ni patient. So si arterial blood, it is only collected by a physician or respiratory therapist. Okay? Okay, so yun lang class yung ating discussion for today.